Alright, this is going to be axis determination. And areas that we're going to cover here are going to be Enthoven's triangle, confusing concepts, and in this confusing concepts we're going to talk about positive waveform and negative waveforms, vectors, physiological and pathological left axis deviations, and right axis deviations, and then extreme right axis deviation. First of all, here we're going to talk about Enthoven's triangle, and Enthoven's triangle is a representation of the bipolar leads on the patient. So we essentially place 4 electrodes, and these electrodes down here, these would be limb leads. These are going to be on the patient's right leg and left leg. And then from there, we get to look at electricity traveling between these 2 poles. So this would be lead 1. And the positive electrode is here on lead 1. This would be from right arm to left leg. And this is considered, and the positive electrode would be down here, right there. And this would be considered 60 degrees. This right here is 0 degrees, and I'll kind of explain this a little more here in just about a second. And then from our left arm to our right leg is 120 degree camera shot. And the positive electrode is down here on that picture. So we look at in the bipolar leads, we look from the positive electrodes back towards the negative electrode, and that would depend on which camera shot we were actually looking at. Clear this off of here. Okay, so here's what gets confusing about Enthoven's triangle. The way the 12 lead looks at it, all of these lines intersect. So this is a negative, 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 and a positive, positive, positive. And this is where we come up with the degrees. So a circle is 360 degrees, and we would have to have a starting point. So the easiest starting point is the positive electrode on lead 1. Same plane as this one here. So from the positive camera shot, 0 degrees, and then the negative lead would be 180 degrees. Now, pretty early on they figured out that they needed positive and negative poling. So this is all positive, and 0 to 180 degrees up here is all negative. So 0 to 180 degrees on the bottom, positive. 0 to 180 degrees on the top, negative. Okay, so that means that this would be 90 degrees. And lead 2 is about 60 degrees. Lead 3's positive electrode is about 120 degrees. So the question is do you understand where I'm coming up with this numbering at? And it's because of the way that the 12 lead looks at the heart. Now, from this, we have known points, and those known points can help us triangulate or fix a position, and that's what we're going to be doing here a little bit later on in Axis. Okay, the augmented leads. Now, not to confuse, still goes off of the same rules here. Where all 3 lines intersect, the machine places a center terminal. This is still lead 1, just to give you a point of origin, 0 degrees. That would mean that this up here was negative 90 degrees, and that this down here was positive 90 degrees. And this is augmented voltage front's position, positive 90 degrees. This right here is augmented voltage left, which is negative 30 degrees. And augmented voltage right is negative 150 degrees. Now, it's very important that you understand where I'm coming up with this number set. Now, the next slide is all of them, all 6 leads. we're looking at them simultaneously. And this is how the actual 12 lead looks at the heart, and this is called a hexaxial reference. So a quick review of this, and if you don't understand this, you need to go back to the previous slide sets or give me a call. This is a very important concept. If you do not understand this, you're not going to understand Axis. So lead 1's positive electrode is at 0 degrees. Lead 2's positive electrode is at 60 degrees, and this is the direction that the EKG machine looks at the heart. So lead 1 looks at the heart in this way. Lead 2, this way. Lead 3, augmented voltage left, augmented voltage right, augmented voltage front. So all of these are like cameras. You have 6 of them that separate the body into front and back, or anterior, posterior. And this is those that we're looking at right here. And each one of those have a specific known location, and those are the known locations. Again, the reference line is 0 degrees, positive electrode starting point for the hexaxial reference. That means that this is the negative lead at 180 degrees. All of this on the top, negative numbering. All of this on the bottom, positive numbering. And then we can see the location where if lead 2 was placed here, or on the leg, the left leg, and that there was an electrode placed on the right arm, that it would look about 60-degree camera shot from the lead 2 position. And that's where we come up with those numbers. So lead 1, very important that you remember them, is 0 degrees. Lead 2, positive 60 degrees, augmented voltage front, positive 90 degrees. Lead 3, positive 120. Augmented voltage left, negative 30 degrees. Augmented voltage right, negative 150. The augmented leads do not have a bipolar presentation. They are only one pole, and that's where the lines intersect. The computer placed a central terminal. So these are only one pole, kind of like the unipolar leads. They don't have a negative pole. They just look from a positive pole's position. Leads 1, 2, and 3, not only do they have positive poles, but they also have negative poles. That's why they're called bipolar. Confusing concept. Everything that you see on the EKG, if it's above the isoelectric line, was headed towards a positive pole or away from a negative pole. This is called vectoring. Anything below the isoelectric line was headed towards a negative pole or away from a positive pole. And here's a nice little picture of it. So if I'm above the isoelectric line, that means if whatever position or whatever lead that I'm looking at, the electricity is headed towards a positive pole. If I'm below the isoelectric line, that means that the energy was headed towards a negative pole. Now this means vice versa as well. I was headed towards a positive pole or away from a negative pole, and I was headed towards a negative pole or away from a positive pole. Axis deviation from these known locations, and this is a hexaxial reference picture here. From the hexaxial reference, we have known locations. So these numbers need to be remembered. And let's start off with normal axis. So some people have a larger left ventricle. It is very easy for us to see what is considered a physiological left axis deviation. So we give a 30-degree variance on this numbering. So it can be anywhere from negative 30 degrees all the way to positive 90 degrees as far as the direction of the electricity, and we would still consider that normal axis. We give a 30-degree variance, which is into the negative numbering, that someone can have electricity traveling that direction and still be normal. Now, anywhere from negative 30 degrees to negative 90 degrees in this quadrant, if your electricity was traveling in that direction, that would be a pathological left axis deviation. Anything from 90 degrees all the way to 180 degrees positive would be a right axis deviation. Now, these axis deviations, whether they're going left or they're going right, are indicative of something called a hemiblock, and we'll talk about that here in just a second. This section here should be your starting location for your electricity, not the ending location. So if electricity is actually headed into this zone, it probably started in the ventricles somewhere. So really look at your clinical indications for possible VTAC. This is called ERAD, or extreme right axis deviation. Alright. There will be one of these cards given to you in class, and this is a rapid axis determining card. And this is a good way to check what the computer comes up with. So there's no two patterns alike. We'll talk about these in both degrees, 90 degrees, and so on, so we can refer to the previous chart that we just talked about, or we'll give it to you in up, down, down, up, up, up. And what this means is what's the most of the QRS doing? Is it above or below the isoelectric line? Because this is going to tell us known locations. And this technique is called vectoring. So, normal axis, and this is the first one you need to remember, all QRS directions are mostly above the isoelectric line. If that is the case, then that would also say that your patient has normal axis. Physiological left axis deviation. This would be, lead 1 would have an up position. Lead 2 may have an upward position or biphasic, and lead 3 would be negative, below the isoelectric line. A pathological left axis deviation. Now these three here indicate pathology. So a pathological left axis deviation would be from negative 40 to negative 90 degrees, and it would give you a presentation of lead 1 would be up, lead 2 would be down, and lead 3 would be down. It would also be indicative of an anterior hemiblock, and I'll explain these here in just a second, as soon as we can take a look at where the anterior and posterior fascicles are located. It's a lot easier to explain it on the picture. A right axis deviation, positive 90 degrees to positive 180, is going to give us a negative deflection in lead 1. In lead 2, we can come up with three different options here. We can come up with positive, biphasic, or negative. And in lead 3, we're going to have a positive. So no two patterns are the same. This would be also indicative of a posterior hemiblock. As far as this lead goes, this is probably the most confusing and the hardest one to catch on a right axis deviation. But if you are at 90 degrees to 180, looking at that zone, it would depend on how severe your right axis deviation is. The more rightward it is, to lead 2's perspective are 60 degrees. .60-degree camera shot. If you're coming out at 91 degrees, it's going to look like it's above the isoelectric line. If you're coming out at about 120 degrees, it may look both above and below the isoelectric line. If you're coming out at 179 degrees, it is not going to look like it's headed towards this positive electrode. It's going to look like it's headed away from it. So it'll be negative or below the isoelectric line. And last but not least, our extreme right axis deviation greater than 180 degrees, or this would be up top, negative 90 to negative 180 in this quadrant. Up top, we had like essentially four quadrants, 30-degree variation, normal axis, left axis deviation, right axis deviation. And then this was ERAD. So if your electricity was traveling into that quadrant to lead 1, 2, and 3, instead of being above the isoelectric line headed towards a positive electrode, you would look like you were headed away from those positive electrodes. So that's why extreme right axis deviation gives you negative presentation in all 3 leads. And we should consider this, if we see this, ventricular in origin. Hemiblocks. A hemiblock is a block of one of the fascicles of the left bundle branch. Now, we generally see these, maybe not drawn, but if this was the AV node, you have a right bundle branch, a left bundle branch anterior fascicle, and a left bundle branch posterior fascicle. This appears a bundle of His. Doesn't really want to know what it wants to do with its life yet. So once the left side branches off and all the electricity is going into the left bundle branch, the left bundle branch then branches off again. So a block of one of these fascicles, no matter which one, is considered a hemiblock. I'll clear this off here. So a hemiblock you have to look at the perspective of where the electricity is traveling. So I'll give you an example of this. A hemiblock in the anterior fascicle would cause the energy that we see there all the time to probably be conducted down the posterior fascicle. So if the anterior fascicle is blocked, you're going to have what is considered a leftward axis. If this leftward axis is above negative 30 degrees, then it's going to be considered a left axis deviation. And whenever we call it left axis or right axis deviation, both of these are pathological in origin. As far as right axis deviation goes, the EKG is set up to look at electricity always traveling down that posterior fascicle. So, to the perspective of the EKG, at the point that you have to return in to be conducted, depending on how much that turns in, depends on your presentations to the leads. I'll kind of explain this. On a right axis deviation, which is positive 90 to positive 180, if you're 91 degrees to lead 2's perspective at a 60-degree camera shot, positive electrode, it's going to look above the isoelectric line. At 120 degrees, it'll probably look biphasic, equal distance above and below. At 179 degrees, it will have a negative presentation. So the lead that, and then we're talking about lead 2's perspective, to the 120 degree camera shot here on lead 3, it will look above the isoelectric line. And to lead 1 at 0 degrees, it's going to look like it's below the isoelectric line. And we're talking about a preponderance or most of the QRS waveform. Okay, so one more to talk about here, and then we're going to talk about them again so we can really drill this home. This would be negative numbering, ERAD. So to lead 1, 2, and 3, 0, 60, and 120, These are all positive electrodes. So if it was headed in this direction, from all of their perspectives, point of origin would probably be somewhere in the ventricles. Alright, last but not least here, just off of statistics alone, a hemiblock in the presence of any acute myocardial infarction increases your mortality 4 times. So if you had a 25% chance of dying from an LAD occlusion or a left anterior descending vessel occlusion, that would multiply that by 4 times. You couldn't even make a bet in Vegas on that. That would be a 100% chance of dying. Just to give you some rules of engagement here. You see a hemiblock, the patients can be sicker. The fascicles of the conduction system are already blocked. And very simply, it means that it may increase their mortality. Alright, so an anterior hemiblock, and we're going to talk about these in turn here. This is a block of one of the fascicles, the anterior fascicle, more specifically. AV node, right bundle branch, left anterior fascicle, left posterior fascicle. So we have a block of the left anterior fascicle. I'm going to change paint colors here. Let's just kind of redraw this. Okay, so the AV node is here. You have a right bundle branch, Purkinje fibers. You have a left anterior fascicle and a left posterior fascicle. If you have an anterior hemiblock, which would be a block in the anterior fascicle, the electricity that the 12 lead has seen traveling normally down that anterior fascicle now must take a left-hand turn to be conducted. The directional path is what we're seeing here. So to each one of these leads, now remember these are positive electrodes. In lead 1, it's kind of headed in that direction. So it's going to be above the isoelectric line. In lead 2, the question is am I heading towards it or away from it? And the answer is I'm headed kind of away from it. So it's going to be below the isoelectric line. And in lead 3, am I headed towards this positive electrode or away from it? And the answer is away from it, or a negative deflection. Isoelectric line was there. So up, down, down, or positive deflection, negative deflection, negative deflection. If you will please remember that this is anywhere above negative 30 degrees to negative 90 degrees is our numbers. The machine comes up with a nice EKG assessment of where it thinks that the axis is. So we always pay attention to that, but it's always good to double check the machine's work. And that would be if we had the limb leads on there incorrectly. If we had them, if you place them on the limbs, the limb leads are more accurate. So negative 30 to negative 90 as far as the numbers go, or lead 1, 2, and 3 with an up, down, down, or positive, negative, negative deflection. This would indicate that you had a pathological left axis deviation. Posterior hemiblock, and that would be AV node, right, left anterior fascicle, left posterior fascicle. The posterior fascicle is blocked, so this is going to give us a right axis deviation, and it depends on how much of a deviation we actually have. Whether it's almost at 179 degrees, it's at about 120 degrees, or it's at like 91 degrees. Now, to everybody's perspective, lead 1, remember this is a positive electrode, so if we're at 91 degrees, this is going to be below the isoelectric line. Lead 2 The 91 degree version probably looks like it's headed about towards lead 2, so it's going to be above the isoelectric line. The 120 degree version of the right axis deviation, at one point it looked like it was headed towards lead 2, at the other point it looked like it was headed away from lead 2, so it's probably going to be biphasic. And the 179 degree version is going to be below the isoelectric line. So again, it depends on how severe the right axis deviation is to lead 2's perspective. Now, lead 3's perspective, any one of these presentations are going to be above the isoelectric line because it looked like it was headed towards this quadrant, or somewhere in between positive 90 to 180 degrees positive, and that would be a right axis deviation. So whenever we're looking at this, presentation is going to be somewhere between positive 90 and positive 180, this quadrant. Our presentation on direction, lead 1 is going to be negative. Lead 2 can give us 3 different versions of this. It can be above the isoelectric line or positive. It can be biphasic, which means above and below, or it can be negative, depending on how severe the right axis deviation is. Lead 3's perspective, since it's in this quadrant or headed towards this quadrant to begin with, and you have a 120 degree camera shot there, will be above the isoelectric line or positive. ERAD, or no man's land. Extreme right axis deviation is between negative 90 degrees and negative 180. I need to tell you 2 things in this slide set. This numbering in this quadrant may change if your patient is tachycardic and it's coming from multiple locations, and I'll explain that whenever we take a look at some of the 12 leads that I have here. So we should consider that this is ventricular in origin. To the positive electrodes, the electricity appears that it is headed away from those positive electrodes. So in all 3 leads, it is below the isoelectric line. So negative, negative, negative. And our numbering on our 12 lead machine will be between negative 90 and positive 180. Now here's the or. Sometimes, whenever the machine sees multiple locations that the electricity is coming from, or multiple focal information, it will go back to a 360 degree point of view. So then your lead 1 is still the starting point at 0 degrees, but it's also 360. That means that this negative 90 changed to 270, and this is still 180. So if the machine gets confused because you do have things like VTAC, it could give you anywhere between 190 to 270 degrees or negative 90 to 180, either one. In either case, it's considered an extreme right axis deviation, and it would help us determine ventricular tachycardias. A bifascicular block. A bifascicular block is a serious conduction problem that essentially is 2/3 of our conduction system is blocked. Now, an example of this, a right bundle branch block with an anterior hemiblock is a bifascicular block. Bi meaning 2 out of the 3 pathways are blocked. This means that there could be a serious cardiac conduction problem. Very simply, 2 out of the 3 pathways are blocked. If this person stands up, they can go, if you put more demand upon them, they can seriously go into 3rd degree heart block in your presence within a 6-second strip. So be very careful whenever you have a bifascicular block that these patients are essentially carried or assisted as much as you can. If they go into 3rd degree heart block, please have your quick combo pacers and your ability to quickly transition to ALS treatment modalities or they could die from low perfusion. Examples of this: if their blood pressure goes from, say, 140 over 80 to 40 over 20 because of low cardiac output, that would be detrimental. Bifascicular block. So by definition, and in the next slide set, we're going to learn how to determine bundle branch blocks. So any bundle branch block with any axis deviation, whether it be left or right, together would make a bifascicular block. This is the conduction system we've been talking about: the AV node, the bundle of His, the right bundle branch, and the left bundle branch. Now, a hemiblock is a block of one of the fascicles in the left bundle branch. So if I had a left anterior fascicular block, I would have a left axis deviation. If I had a left posterior block, then I would have a right axis deviation. In a bifascicular block, the patient is sicker than a normal acute myocardial infarction. They may go into complete heart block very rapidly. We talked about that. You should have the quick combo pads placed upon them. It is considered a high degree heart block. So anytime that you see contraindications of any of your antidysrhythmics, the bifascicular block is a high degree heart block. It doesn't formulate itself up quite like a third degree heart block or second degree type 2. But lidocaine and procainamide, things like that would slow conduction velocity or increase your QT interval, definitely are contraindicated. Now, very simply, if the patient has formed something, like let's say that the patient has formed VTAC, make no mistake, you need to treat the VTAC with antidysrhythmics. Just keep in the back of your mind that whenever the patient comes out of this, if we have an ROSC from this, that very simply, we will probably be in a severely bradycardic rhythm. In unstable patients, place quick combo pads on them immediately. Be prepared to pace the patient at any point. Some may tolerate this well until they stand. The heart cannot maintain the extra demands put upon it due to its compromised conduction system, and they could go into complete heart block, which would be a third degree AV block, very, very rapidly. Okay, so we're going to go through the practice here, and we're just looking at two locations really quick. I'm going to show you where the machine comes out with the axis. So these are three numbers here that the machine figures the axis for. Now, we're going to go ahead and plot it and kind of show you two different ways of determining this. So the first way here is to look at what the machine come up with. The machine come up with 106. So we're going to draw a little quadrant thing here. This is 90 degrees positive. This is 90 degrees negative. This is 0 degrees. This is lead 2 at 60 degrees. Lead 3 at 120 degrees. All right. So the machine says the energy is coming out about right here-ish. This would be the quadrant for a right axis deviation. So we need to check our work here. I'm going to switch pin colors here really quick. Back to, say, a red. So the machine says, and this is a down, up, up. The isoelectric line's there. So is most of this QRS above or below? And it's below. This one is most of this QRS above or below? It's above. Is most of this QRS above or below? It's above. So down, up, up. So lead 1's perspective is it's going away from it. Lead 2's perspective, and these are positive electrodes, these three known locations. Lead 2's perspective says that I'm headed towards it, so we're probably popping out right at about 91 degrees or something like that, 92. The machine says 106. Let's check our third one here. And our third one says it is popping out here too at about 106. So somewhere around here is where that beat is headed towards, off of 3 known locations. This is kind of like triangulating. So print off those cards, or have your instructor print off those cards that are on there, or use the cards that I've given you and double check the computer's work. It never hurts. So we have a down, up, up, 106. The machine, in my opinion, is on the money. All right, practice number 2. Negative 75. $120, 60. This one up here is 0 degrees. Machine says we're headed about this direction right here. Negative 75 degrees, give or take. To lead 1's perspective, it's headed towards lead 1 indirectly, so it's going to be above the isoelectric line. Lead 2's perspective is the electricity headed towards it or away from it, and it's away, so it's going to be below the isoelectric line. And leads 3 perspective is it headed towards it or away from it, and away from it is the perspective. So up, down, down, we have an up, down, down perspective. So I agree with what the machine comes up with, negative 75. This person here has a left axis deviation or an interior hemiblock. Right, left anterior, left posterior. So if this one's blocked, the only way that they can go is like this. Practice 3. Now this supplies that other rule that we had talked about earlier, that we're going to talk about this. The machine come up with 241 degrees. However, down, down. The question is the machine always knows where the isoelectric line is at, because it knows what zero amplitude is, or zero electricity. So the question you ask yourself is in leads 1, 2, and 3, is the electrical QRS above or below the isoelectric line? And in this case, it is below the isoelectric line in all leads 1, 2, 3. Now that is a pattern for ERAD. The machine come up with 241, so let's kind of look at that. And that's because it saw multiple focal areas here. This is negative 90 or 270, and this is negative 180 or 180, depending on how the machine looks at it. So is 241 degrees between 180 and 270? And the answer is yes. So this is ERAD. To the other leads perspective, lead 2, lead 1, and lead 3, 60, 0, and 120, it looks like all of the energy is headed away from it. So this probably started somewhere in the ventricles. It should just increase your suspicion. Now, I left one more thing up here. This is the Doc in the Box's version of what's going on. This person is in VTAC, rate greater than 180 beats per minute, QRS duration greater than 0.12 or 120 milliseconds, and a QRS axis of 241 degrees in ERAD quadrant. The machine comes up with atrial tachycardia with second-degree AV block, Mobitz type 2, non-specific interventricular conduction block, right ventricular hypertrophy, inferior infarct, probably recent, anterior lateral infarct, probably recent, abnormal EKG. It got one thing right. Abnormal EKG. Please check your work. You cannot trust the verbiage that is spit out by the Doc in the Box. This stuff over here is highly accurate. If you have your leads placed right, then you can pay attention to this every day and twice on Sundays. This stuff over here, it's a coin toss. Practice number 4. We're going to start doing these a little bit quicker. There's some more practice in the homework in this section. Negative 46 degrees is what the computer come up with. So somewhere around there is where our electricity is headed. From lead 1, lead 2, and lead 3's perspective. This is going to be above the isoelectric line, below the isoelectric line, below the isoelectric line, or an up, down, down. Up, down, down. This is an anterior hemiblock and a left axis deviation. Number 5. (160 degrees), 90 degrees positive, 180. We're at about right there, which we have a downward, biphasic, and an upward. 0 degrees, this is lead 1. 60 degrees would be lead 2. And 120 degrees would be lead 3. So is it headed towards this or away from it? The answer is it's away, so down. For the 60 degree camera shot or lead 2, it's biphasic. So at one point it was headed towards it, the other point it was headed away from it. This would be a right axis deviations perspective, or biphasic, off of your cards. And then since we're headed in the quadrant that the positive electrode already is, this one's going to be above the isoelectric line. So do we have a down biphasic up, down biphasic up, or 160 degrees? This is a right axis deviation. Practice number 6. Last one. We have that funky numbering again. 248. Negative 90, negative 180, or 180, and 270. 248 is about here. This is ERAD quadrant, according to that, and below the isoelectric line. So down, down, down. All 3 leads perspective, 0 degrees, 60 degrees, 120 degrees, say that it's headed away from them. Probably ventricular in origin. I left the doc in the box here as well. It found a lot of things. None of them are true. And nowhere, anywhere in there does it say VTAC. In conclusion, please understand the hexaxial reference and be able to plot it. Lead 1, lead 2, lead 3, augmented voltage left, augmented voltage right, augmented voltage front, and know where I'm coming up with all the numbers. It will help tremendously. Know what a hemiblock is. It's a block of the conduction system, whether it be in the anterior fascicle or the posterior fascicle. Know what ERAD is. Off of our quadrantine system, ERAD is right here, either negative 90 to negative 180, or 180 to 270, somewhere in this quadrant. And then a bifascicular block, a bundle branch block with an axis deviation, either direction, is a bifascicular block until proven otherwise. References for this section was taken from Myers Professional Paramedic Volume 2, Medical Emergencies, Maternal Health and Pediatrics, Del Mar Learning. Green, 12 Lead EKG Confidence, 2nd edition, by Springer Publishing. And Page, 12 Lead EKG for Acute Critical Care Providers, by Pearson Education.
If you have any questions concerning this slide set, please feel free to give me a call. My name is Roy Smith, smithr@SamaritanEMSOK.com or 405-492-8243. Thank you.